Hello everyone, my name is Dr. Singh, neonatologist and assistant professor of pediatrics at Texas Tech University and Health Sciences Center at El Paso and El Paso Children's Hospital. And welcome back to PEDPod, a podcast where we bring you up-to-date information on common problems related with health of all children. And today in our second episode, we are going to talk about influenza, or commonly known as flu, a very common disease that affects a lot of children. To enlighten us on this topic, today I am speaking with Dr. Thomas Mays, who is a professor and interim chairman of Department of Pediatrics in Texas Tech University here at El Paso and pediatric intensive care doctor at El Paso Children's Hospital. Before we begin, Dr. Mays, I would like to share with our listeners that he himself had a significant encounter with flu last season, so this is all too fresh in his mind. With that said, I welcome Dr. Mays to our PEDPod. So before we begin, what is flu?
So, flu is one of the words that is often misused, and I think people talk about a stomach flu or the common flu, and in that sense, people are referring to viral infections of some sort. But influenza or flu is actually a very specific virus, and it's a virus that's been around for thousands of years. And it's an interesting virus in that it changes every year from a particular genetic material to a different genetic material, which actually is a challenge as we try to develop vaccines or treatments for it. So influenza commonly is characterized as influenza A or influenza B, and that really has to do with some molecular biology of the viruses, which is probably not too important to the listeners. But the clinical manifestations aren't any different between the two, and it's a disease that is self-limited. Most people who get influenza are ill for a few days, but it's also potentially a killer. And I think it's important that your listeners understand that influenza is actually something that you got to pay attention to. It's preventable to a large degree, and then there's some treatments, but they're mainly supportive care. And then there are complications of influenza that people need to be watching for.
Well, I think that's very important for everybody to understand that there are some signs and symptoms that we should be looking out for. So what are those signs that a parent can look for?
So I think, first of all, when you start talking about signs and symptoms of influenza, they're classic symptoms that a child or an adult will have. So one thing is it's the time of the year. So influenza is a wintertime illness. That's important for people to know.
Absolutely right.
It's a wintertime illness in the northern hemisphere. It's a summertime illness in the southern hemisphere. For us, it's the summertime. There, it's the wintertime. And so for international travelers, that's an important thing to remember, is that while it may be summer here, it's not in Australia, and they're having influenza at that time. It is highly contagious. It is transmitted by respiratory droplets that come into contact with solid materials in the house or in the hospital. We call them fomites, and basically that's where the virus hangs out, and it hangs out there for a day or so at least, and that's where the infections generally are coming from. And the classic manifestations of it are: A, you have fever. B, that your fever can be significant. So I'm going to be using degrees Fahrenheit here. So we're talking about 102, 103 degrees fever, and there's often cough associated with influenza, and there's often chills, which are rigors, where people will shake. And if you're an adult and can describe this, you also have myalgia, so your muscles ache, and so those are very classic common symptoms of influenza. You can also have headache associated with it, but other things like diarrhea or skin rashes or things like that, those are not commonly associated with influenza.
So when should a parent take their child to a doctor?
Okay, so I think first of all, the parent takes their child to the doctor in the context of a few things. One is they know their children the best. And
That's
so
true.
if a child, appropriate time of year, is in school, and there's a lot of influenza in the community, and a child is having fever, a runny nose, and coughing, and is not acting well, that child needs what we call supportive care. And supportive care in this case is medication for fever. That's going to be either acetaminophen, commonly known as Tylenol, or it would be ibuprofen, commonly known as Advil. And those are effective at reducing fever and actually providing some comfort. Lots of liquids. So the thing about lots of chicken soup is actually true. It's more the liquids than the chicken, but lots of liquids. Child needs to not to go to school. But when should people get worried? Well, if the child is persistently ill past 3 or 4 days, that's one thing. And here I'm talking about fevers, or particularly high fevers, or the child is unable to take any liquids, or the child is acting different, and here I'm talking about not being responsive.
Okay.
Those are all very, very worrisome things. And so those would be the general recommendations about when a child should seek medical attention. But the people at highest risk of complications related to flu are actually young children, older adults, people with immunosuppression, and people with chronic diseases, particularly pulmonary diseases. And people need to understand that children do die of influenza every season. Adults die of influenza every season. And that's why people need to pay attention to it and use the strategy we have to help prevent it and also to treat it when necessary.
That's a great advice from you, Dr. Mays. Now that brings me to a next question. Is there a specific medication that...
So the answer is yes. There's a particular medicine that is an antiviral that's known as Tamiflu. That's what it'll be commonly called. That's a trade name. Tamiflu is an antiviral that is effective for influenza A or B, and it can be given orally to children or adults. And if Tamiflu is administered in the first day or so of influenza, it will reduce the length of illness and the severity of illness, but it does not make the illness go away. A little bit of a problem with Tamiflu is that it upsets the GI tract significantly, and so if you have a child and you're giving them Tamiflu and they're throwing it up or they're refusing to eat, it's because their stomach's upset, and that's the basic limitation of the medication. Overall, it's a safe medication, but it's not the same as, let's say, an antibiotic for an ear infection. That will actually a cure.
Right.
This is going to shorten the degree of the timeline of the influenza and reduce the symptoms, but the patient's still going to be sick.
It doesn't take the disease away completely.
That's
but
correct.
It does help a little bit to relieve some
Symptoms,
pain,
yeah.
some symptoms. Excellent. The next question that I have, I've been asked a lot of times: is there a vaccine for this disease?
There's a vaccine for influenza. As I described earlier in our discussion, this is a virus that changes all the time, as opposed to other viruses. So other common viruses like measles or varicella, which causes chickenpox, those viruses are pretty stable, and that makes them easy to vaccinate against. But influenza, it changes its genetic makeup every season, and so that makes it difficult to create a vaccine. And so the vaccines are created based on experts' best guess as to what particular subtypes of these influences are going to be present. And so there will be times when the best guess is pretty good, and there will be times when the best guess is not so good. Last year's flu season, which was the winter of 2017 and 2018, the vaccine was not particularly effective. There are all sorts of numbers quoted, but let's say it was 40% effective. And then in a good year, you have vaccination rates that are more like 80% effective. But unfortunately, right now, there's not a universal vaccine like we have for measles, for mumps, for varicella, all sorts of other viral illnesses. And so it's a lot of guesswork involved, but it's the only thing we have that can prevent influenza, or if it doesn't fully prevent it, it will reduce the severity of it. There is ongoing work to create what they call a universal flu vaccine that's developed differently, and that would actually really help a lot, but we're still years away from that. And so in the meantime, it's the annual vaccination, which is recommended for actually anybody over the age of 6 months. And it's no longer limited to high-risk groups. It's anybody over the age of 6 months. The recommendation is vaccination.
There's a lot of talk about it on social media as well, that why should I take it if the vaccine is not effective?
Right.
What do you say to that?
I say that the vaccine, even with low effectiveness, will reduce the degree of illness, may not totally prevent it, and potentially will reduce the spread of the illness by a mechanism we call herd immunity. Given the influenza vaccine is not as good as like the measles vaccine, but vaccination is really the only effective prevention strategy we currently have. There are specific contraindications or reasons not to use the vaccine, but they're actually very, very few.
Yeah,
and the vaccine does not make you sick.
That's an excellent point that you just made, that vaccine doesn't make you sick. That's the other common myth that I hear from people around me.
Right, unless you're allergic to something,
right.
there won't be any
right.
real side effects. And I think part of the confusion when people say, well, I got my flu vaccine and then I had the flu the next week. Well, they probably did not have influenza. They probably had a viral infection from one of the other viruses that causes respiratory viral infection. But we all call it the flu. Commonly, that's the lay term for this, but it's not necessarily influenza.
And the last thing that I want to talk to you about is, as a parent who's sitting at home and wants to research this topic,
right.
and to think about better evidence-based approach, where should they go and look for?
So the great source of information is actually your own healthcare provider. That's the best source, because you can get specific questions answered. You have a relationship with your pediatrician or your family doctor, and that's the number one best source. But having said that, there are other sources of information, and so the two that I would recommend that are easy to get to, one is the American Academy of Pediatrics website has a place where parents can get information, and that's aap.org. And so it's just, and then the other is the Centers for Disease Control, which is a federal agency that's charged with disease control, and that also has very helpful and really helpful information. Most people don't think about going there, and that's cdc.gov.
Well, I really want to thank you, Dr. Mays,
Sure.
for all the input that you just did for us, and for all the hard work that you do for the health of all children in our community.
Happy to help with this.
Thank you. And thank you to all the listeners for tuning in to listen to our Pete Pod. You can listen to it on the Texas Tech University's website and at El Paso Children's Hospital's website. And next month, we'll be back with a new exciting topic.
Great.
Thank you.
Well, thank you very much for having me.
Thank you also.